In Australia, more than 1,600 women are diagnosed with ovarian cancer each year. There are several different forms of this cancer, all of which will be discussed in the next few minutes. We will guide you through the cancer's risk factors, symptoms, investigation and diagnostic processes, as well as the treatment paths available to you.
Ovarian cancer is a quite common disease, and we will diagnose about 1,600 Australian women a year with that disease. We need to take this disease very serious, although we have made very significant advances and advancements in its treatment. Ovarian cancer normally develops from the outside of the ovary. This is what an ovary normally looks like in a menopausal woman. But if there is a cancer on there, these ovaries, you will not be able to recognize these ovaries anymore. They will swell up and become really, really big and fill out the entire pelvis, where the entire pelvis can be full of cancer. And in that case, it is very important that we can treat this woman properly, because the treatment can actually achieve a lot and help some women survive this terrible disease.
The risk of ovarian cancer in the general population is 1.3%, but if a woman has a mutation in the BRCA gene, this risk can be as high as 60 to 80%. Women who have a history of ovarian cancer and breast cancer in their family are also at greater risk of developing ovarian cancer. The symptoms associated with ovarian cancer are very unspecific, which means that even healthy women may develop these symptoms from time to time. They include bowel irregularities and urinary frequency or bloating. However, if these symptoms persist or develop in a combination with each other, they do require investigation. Unfortunately, in most patients, those symptoms indicate an already advanced stage of the disease.
Well, in the beginning, didn't know what it was, but I knew there was something there. And then after just doing the blood tests, the CAT scans, going to my own doctor, and then he putting me straight up to Andreas Obermeyer, and we went from there. And he did me, operated on me, and then I had 6 months of chemo after that. And then I started going again. Everything was fine. And then a couple of years later, in 2009, a breast came back on the right, dealt with that one. And then last year of 10, ovarian came back again, which was in the pelvis and the abdomen, back to Andreas Obermeyer, and we dealt with it again. And now chemo is finished again, and everything is going fine. My markers are down. But you just get on with it. You've got to be positive and do this and do that, and then you'll be fine. Not go into a heap, because every day is another day. You know it's not a life sentence, put it that way. And then you have your chemo or whatever you have to do, your radiation, and everything gets better again. And then there's a long life after that.
The investigation process to determine the diagnosis of ovarian cancer involves medical imaging and blood tests. Medical imaging may include an ultrasound and CT scan. The imaging and blood tests will not be able to confirm or exclude the presence of cancer, but in combination, these investigations will be able to give Professor Obermeyer more information to determine the probability of cancer being present. If masses are thought to be suspicious, surgical exploration will be required. This can be done through laparoscopic surgery or through opening of the abdomen by an up and down incision. The assistance of a pathologist in theatre may be required to determine if a mass is malignant or benign. The surgical procedure depends on whether ovarian cancer is confirmed at the time of surgery. If a tumour is confined to an ovary, biopsies will be taken from other parts of the abdomen and pelvis to ensure the cancer hasn't spread. If it is apparent the cancer has spread already, surgeons will attempt to remove as much cancer as technically possible during the procedure. If this is the case, it will involve a long operation, and the patient may need to be admitted to the intensive care unit for monitoring after surgery. Following surgery, most patients with ovarian cancer will require chemotherapy, which Professor Obermeyer will arrange for. Once all treatment is completed, follow-up consultations with Professor Obermeyer alone or alternatively with another specialist will be required every 3 to 6 months for a number of years. He will ask you for any symptoms such as bleeding or pain, bowel irregularities or urinary symptoms. Physical examinations, blood tests or CT scans may also be arranged at these consultations for further reassurance that the patient is still healthy.